Did you know that 1/3 of patients who undergo knee replacements may not actually need them? That's about 200,000 unnecessary surgeries performed every year, and upwards of 20% of those who undergo total knee replacement are not happy with the results. So if you're thinking about getting a knee replacement, it's important to understand what you're getting into and whether or not it's actually necessary. Because if you're going to go through the hassle of surgery, you want to make sure you're going to have good results. In this video, I will be exploring the factors driving overutilization of total knee replacements, understand why some people come out unhappy with the results, and highlight strategies to enhance recovery. I will also be laying out key factors to help you determine if knee replacement is the right choice for you. This video is not intended to turn people away from total knee replacements. These surgeries are highly successful, with over 80% of patients reporting less pain and improved mobility. But the significant increase in the number of procedures performed annually raises some serious questions of whether or not these surgeries are actually needed. Each surgery costs upwards of $31,000, contributing significantly to hospital profit margin, which naturally raises some concerns. Last year alone, a staggering 700,000 total knee replacements were performed in the US, and this number continues to rise each year. So it wouldn't be too far-fetched to claim that doctors may be a bit too quick to recommend surgery to their patients, contributing to the rise in less than optimal outcomes, particularly among patients with less severe pain and degenerative changes. Because despite the advancements in total knee surgery, knee replacements do have their limitations. While knee replacement can be a game changer for those with more severe arthritis, research suggests that patients with less severe arthritis are more likely to be disappointed with their results, as they are less likely to experience notable improvement in their function. This is due to the limitations in the biomechanics of the knee replacement, which does not perfectly replicate the movement of a natural knee. This can make activities like squatting, kneeling, and twisting limited, so those who are more active may experience a reduced ability to participate in higher level activities that they once performed. So recommending surgery to the right people who stand to gain the most benefit is critical to the success of the total knee replacement surgery. And to optimize decision making and improve post-surgical outcomes, doctors are recommended to use assessment tools to assess a person's suitability for surgery. However, with the hundreds of thousands of more surgeries being performed each year, it seems this is not always the case. And just to highlight this, a study investigated how closely validated decision-making tools were utilized when judging the appropriateness of a total knee replacement in real patients. Some of the primary considerations utilized on the decision-making tool include the level of pain, the degree of functional limitation, the patient's age, knee joint mobility and stability, and the severity of degeneration seen on x-rays, rated on a scale of 0 to 4, with 4 being the most severe. This was determined utilizing what's called the Kellgren-Lawrence scale. The researchers found that 34% of patients in the study were technically inappropriate for surgery when following this decision-making tool. Now, what does inappropriate exactly mean? Well, it means that expected harms outweigh the expected benefits. But who exactly would be deemed inappropriate? Well, this study highlights 6 groups of people who should technically not be recommended for surgery. Here's the decision-making tree that was utilized to categorize those who had a knee replacement. On the left are those who have slight to moderate pain and disability, and on the right are those who have more severe ratings of pain and disability. Let's first look at the left side of this decision-making tree for those with mild to moderate pain and functional limitations. People were deemed inappropriate for knee replacement in this group if they fell into the following 4 categories: slight to moderate pain and functional limitations with signs of degeneration on x-rays less than or equal to a grade of 3, slight pain and functional limitations with an arthritis severity grade of 4, moderate pain and functional limitations with an arthritis severity grade of 4 and who are under the age of 55, and moderate pain and functional limitations with an arthritis severity grade of 4 in only one aspect of the knee and were over the age of 55. The group that made up the largest majority of people receiving inappropriate knee replacements belonged to the group with slight to moderate pain and functional limitations with signs of degeneration on x-rays less than or equal to the grade of 3. This side of the decision-making tree highlights how just because someone has visible signs of degeneration does not necessarily indicate they need surgery. It is often better to preserve the natural joint if possible, especially if pain is manageable and function is sufficient. Again, the biomechanics of the knee replacement do not perfectly replicate natural knee anatomy, so you should not expect greater function after a knee replacement if you are already functioning at an acceptable level. Now let's shift to the other side of the decision-making tree for those with more severe pain and functional limitations. There were only two groups in this category deemed inappropriate for knee replacement, and included those with severe pain and functional limitations with an arthritis grade of less than or equal to 3 in only one knee compartment, and were under the age of 55. And severe pain and functional limitations with an arthritis grade of less than or equal to 2, normal knee mobility, and were over the age of 55. This was the most common inappropriate classification for subjects with intense or severe symptoms. This side of the decision-making tree highlights that severe pain and functional limitation alone do not necessitate a knee replacement if the actual structure of the knee itself is not significantly compromised. After all, why replace a joint if it is still functional? And you might be thinking, obviously because it hurts, but it's important to understand that improving pain is more complicated than simply swapping out a joint. There is no guarantee that pain will improve, especially if the joint is not in the advanced stages of arthritis. While people with arthritis are more likely to experience pain than those who do not, this is not always the case. Studies have shown that some individuals with mild arthritis can experience significant pain, while those with more advanced arthritis might have mild to moderate symptoms. In other words, pain does not always reflect tissue injury, but is more about how pain is being processed. So replacing a joint in someone with mild to moderate knee degeneration may not solve the pain processing issue. But who is appropriate for this procedure then? Well, according to that same study, up to 87% of procedures deemed appropriate was in those over the age of 55 years old with intense or severe pain and functional limitations and arthritis grade scores of 4. The second most common group deemed appropriate was those over the age of 55 years old with intense or severe pain and functional limitations with knee mobility loss or stiffness and an arthritis grade of 3. And even if the patient is deemed appropriate for total knee replacement, success is not always guaranteed. As many as 1/3 of those who have their knee replaced continue to experience chronic pain, and up to 20% of patients are not satisfied with the outcomes. Despite its popularity and successes, this surgery is not perfect. This makes it important for doctors to be more selective in who they operate on, and it makes it important for those with arthritis to exhaust non-surgical options before considering surgery. But unfortunately, this is not happening as much as it should. A recent study revealed that only 10% of patients who eventually had a knee replacement received physical therapy in the 5 years prior. That's right, just 1 in 10 people received physical therapy despite its proven benefits in reducing pain and improving mobility. Instead, 43% received a cortisone injection, 15% received viscose supplementation, and 19% underwent arthroscopic debridement or a clean-out procedure. So instead of being referred to physical therapy, which focuses on improving mobility, strength, and knee control, treatments that have been shown to help reduce pain and improve stability of the joint in those with arthritis, it's more common for people to be provided treatments that only temporarily address the symptoms. Now let's move beyond whether the surgery is appropriate and focus on patient satisfaction with total knee replacement. Because after all, if the surgery doesn't meet expectations, then what's the point? And research has shown that there are specific factors that can increase someone's likelihood of having a bad outcome 1 year after knee replacement surgery. These factors include lower preoperative mental health scores, a history of depression, pain in multiple other joints, lower functional scores 6 months after surgery, and minimal improvement in pain symptoms after surgery. Out of these, ongoing pain after surgery was identified as the strongest predictor of dissatisfaction. And that makes sense. People expect significant pain relief. Otherwise, why have the surgery? Function after surgery was also a factor, but less influential than pain relief, suggesting biomechanical issues like mobility or strength are not as significant in patient satisfaction after surgery. This highlights the importance of surgeon skill to ensure proper alignment and fit of the prosthetic, as well as effective pain management, especially in the earlier stages of recovery to enhance patient satisfaction. But let's not forget about the significant influence of mental health on patient outcomes. Depression and poor mental health are among the strongest predictors of patient dissatisfaction. It doesn't matter if the surgery is performed by the best surgeon in the world. If the patient has poor mental health, their likelihood of a successful outcome is reduced. But how many surgeons are performing robust mental health screenings on their patients? This is why it's essential for healthcare providers to perform behavioral and lifestyle screenings on patients to ensure they receive appropriate services before and after surgery. After all, it's not just a knee issue. We're treating the whole person, mind included. So get your mind right before going under the knife. Deciding to undergo a total knee replacement isn't just about physical symptoms or what an x-ray shows. It requires consideration of multiple factors to assess readiness for surgery and ensure the best possible outcomes. But the decision goes beyond just checking off a bunch of boxes on a list. While studies and guidelines provide a framework, they aren't covering everything. Because as you may have noticed, there are groups of people who don't fit into a category as their appropriateness for surgery is not clear. Each person is unique, and there are always additional considerations that might not fit neatly into standard criteria. This is why no single set of guidelines can be perfectly applied to everybody. The key is to make an informed choice tailored to your specific situation. But before opting for surgery, explore all conservative interventions like physical therapy and lifestyle changes to manage symptoms and improve knee function. Surgery should be the last resort, not the first option. What are your thoughts on knee replacements? Have you considered one or have already undergone the procedure? Share your experiences in the comments below. Well, I hope you found this video valuable. Don't forget to give it a thumbs up and subscribe to the channel so you can stay up to date on everything you need to know about your body, how it works, and what it needs to keep moving.